I'm Colby Clark, and I'm presenting on the strengths, weaknesses, and security impact of HIPAA and PCI-DSS for Natalia Bell's class at Marymount University for IT-800B. For the last decades, computer hacking, malware, social engineering, and other methods of compromises and data theft have been on a steeply increasing trend, both in volume and in monetary impact. The situation has threatened all entities, resource types, and resulted in a combination of security controls and regulatory requirements from various sources to attempt to deal with this escalating problem. The regulatory requirements focus mostly on the victim or the potential victims of the attacks and ensuring that they meet certain baselines of control or protection types, but they don't really specifically provide direct guidance or control selections or even implementations on how to do things right to protect the companies that are affected or the data types. In most, the guidance provides language specifying control families, such as the payment card industry data security standard. However, other regulatory requirements, such as Health Insurance Portability and Accountability Act, HIPAA, only provides strict language about the need to protect patient data and to stipulate requirements for who may access it, but they really stop short of specifying any specific controls that are involved. Both PCI and HIPAA regulations have teeth, and it's not uncommon for breached entities to be fined, sued, or have other restrictions placed on them as a result of the breach. The legal impacts from the cybersecurity breaches are also on the rise and can total in the hundreds of millions or even billions of dollars. It's gotten to become very expensive. As such, they provide a significant motivation for entities to implement security controls in order to avoid being breached and incurring the subsequent liabilities, such as the fines, lawsuits, or other consequences. However, some security practitioners argue that the regulatory compliance requirements are not specific enough to try to drive maturity across the relevant areas of security and may have conflicts with other requirements and other important aspects of the security program. My dissertation will perform a cross-sectional exploratory study using mixed methods and qualitative and quantitative analysis to interview and survey security professionals to obtain responses respective to the positive and negative impacts of both PCI and HIPAA across the various layers of access controls within the environments. While the overall level of security has increased along with the cybersecurity threats and the regulatory requirements, it's really unclear what the actual correlations are between the security posture at each control layer within the target environment and the regulatory requirements that the entity may be subject to. And not just those ones that we're talking about, PCI and HIPAA, but what about the rest of the landscape? How do they all play together as a whole? And while it's clear that the regulatory requirements do provide clear motivation for entities to implement some cybersecurity controls, it needs to be affirmatively established whether the controls being implemented adequately address the threats across the population of the necessary control areas, even though they may not be specifically mentioned within the regulatory requirements. So do they really solve the problem? The potential for negative impact from regulatory requirements on security controls needs to be established. If this situation exists where attempting to comply with a regulatory requirement could cause an adverse security situation across other aspects, that needs to be better understood and documented, and these requirements need to get better fleshed out and aligned across the scope. I created a total of 5 research questions to begin to flesh out the quantifiable and qualifiable impact of PCI-DSS and HIPAA on specific security controls throughout the control stacks. This will be key to identifying where the regulations increase security, diminish security, or just have no impact overall. And there's various different control layers that need to be considered throughout this process. These are pretty high level, but I'll explain them to a certain extent. I'll introduce them anyways. The overall security posture is really the summary of the overall state of security across the control layers affecting the entity and all of its resources, accounts, data, and whether it's on-prem or externally hosted, basically anything that they have access to or use across their environments. And within there, you have SIM capabilities, which is the maturity of an entity's ability to consolidate key log sources and implement use cases, risk-based alerting, RBAs, views, dashboards, reports, and other detection and reporting methods, telemetry, detection response, and things like that to understand what security incidents are occurring within the environment, and to be able to just not only detect but to respond appropriately across in each layer, having the right amount of insights based on that telemetry. Next, you have SOAR capabilities, which is kind of the next layer above SIM, which is the maturity of an entity's ability to implement security orchestration and automation and response, and to expedite incident response workflows such as containment, eradication, mitigation, remediation, things like that, on top of what's being detected. So how do you respond to it? And how quickly can that be done? How much can that be automated? Those automation functions are key to be able to deal with threats effectively and expeditiously. Next, we have data security capabilities, and that's the maturity of an entity's capabilities to secure the data from compromise, even if the data repository or the system, the service, the application, the share, wherever the data is located is compromised. What is the entity's ability to secure that data in lieu of that, to prevent that data from actually being compromised and read by unauthorized individuals? Next, we have cloud security capabilities, which is the maturity of an entity's capabilities in defending against cloud security and privacy threats based on utilizing cloud security controls and the respective computing resources that are available to them, to the accounts, to the data, and everything across that layer. Next is network security capabilities, and that's the maturity of an entity's abilities or capabilities to monitor, inspect, protect, secure, detect, and protect and block network traffic across in and out of the organization and within the organization, regardless of what types of threats it might be facing. There's often a lot of blind spots within network security capabilities. You typically see a lot of maybe ingress or perhaps egress, but you don't see a lot of east-west traffic types of detection and blocking capabilities. Next is application security controls, which is the entity's maturity and the ability to control their applications and protect all of the resources within them from an application space, which is inside the network space or inside the host space. Then there's account validation, which is the maturity of the entity's capabilities to validate users and their respective access to resources and data. And a lot of this bridges on a lot of the next-gen types of concepts like zero access. Like, do they have the right level of access within their environments? And that also dovetails in with account activity monitoring and security capabilities, which is the maturity of an entity's abilities to monitor, inspect, protect, secure, detect, and otherwise authorize just what the entity needs to be able to do within that account for those respective data sets. Next, we have a list of terms that commonly come up when we're talking about regulatory types of situations, like particularly with HIPAA, business associates, which is an entity that performs services on behalf of a covered entity, which would be the one that has the contract. The covered entity is the one that has a contract with the Health and Human Services, and a business associate is the one that does the business on behalf of the covered entity to do some of the work, and for which the covered entity might be liable for any loss that they might contain. The next is controls, which are security functions that are implemented at various layers to protect the endpoints, the networks, applications, data, accounts, any type of object that requires protection under the regulatory control. The covered entity, which is, as stated, the one that has the contract with Health and Human Services and has the ultimate duty to protect the PHI. HIPAA, which is the Health Insurance Portability Accountability Act, was originally implemented in 1996, and it's had various updates since its initial release. And it's intended to protect protected health information, and it's gone through many different iterations to try to get to that state, and it's still working towards it. And next we have Payment Card Industry Data Security Standard, which is the actual security requirements related to PCI-DSS, and probably the most specific of all of the regulatory controls out there in defining what controls need to be protected, but specific only to cardholder data. And last is regulatory requirements, which is just a generic term to refer to any statutory mandate at a federal, state, local, or industry or data type level for which entities must comply with keeping that data protected. Moving into Chapter 2, PCI and HIPAA are often regarded as strong drivers for security compliance. And is this assumption accurate? Is really the premise of a lot of my research. Do they really positively impact all of the security layers? Do HIPAA and truly really drive the development of real security for compliant environments? Or do they only drive security for compliance sake? That's a really big, significant thing to consider. And if that's the case, do they permit significant vulnerabilities to exist? Moreover, do they drive security at all of the right and appropriate areas, or does compliance focus on strength in some areas but neglect others that could also create a risk and ultimately a liability for the company that's that's being subject to these requirements? So this study will ascertain the efficacy of PCI and HIPAA and their specific impacts on security controls across the respective layers included in the study and implemented in the respondents' environments. The evaluations will be completed, or at least once my dissertation study is done beyond this introduction. The evaluations will be completed by actual security practitioners who have actual knowledge of PCI and or HIPAA and influence on the impact and how these controls are implemented within their environments. This knowledge is critical to organizations and stakeholders that must be in compliance with security, with regulatory requirements and the security controls, as well as the entities that maintain them. The awareness of any gaps or weaknesses can help organizations to compensate for them and remediate the likely gaps that are caused by any kind of compliance-based lapses, and it can help drive changes to fill the gaps and augment regulatory requirements in order to produce not only regulatory compliance, but actual true security within these environments. Now, the goal of the searches that I performed in the literature search was to identify papers, articles, and research that performed critical analysis on the efficacy of PCI and or HIPAA on the actual security controls within the environments, and to be as specific as possible on the impact on each of the relevant security control layers. I searched for literature to respective impact at each of those security layers and didn't find a lot. And ultimately, the security of PCI, DSS, and HIPAA using these various layers was limited to what Marymount had access to and what I could find on the internet. Mainly, my sources were ProQuest and an EBS SEO host. And while it's true that there's a lot that's been written about PCI, DSS, and HIPAA, there is not really a lot about the respective efficacy of either that's in the literature. They kind of stop short and just talk high level about introducing it, what is it. And my main search terms were searching for ultimately for PCI, HIPAA, and security. Most of the literature available focused on the applicability and implementation of PCI-DSS and or HIPAA for various groups of individuals, entity types, and use cases. Talks about kind of how and where it applies, but not exactly to the degree I was looking for. There are 5 articles, papers, or dissertations that were responsive to the search criteria through ProQuest or EBSGO host. Most of the literature on the host was on the subject was fairly short, and it didn't go into specific detail, but it would enumerate the applicability, the key attributes, the components, the relative impacts, the strengths, the weaknesses, and kind of their observations regarding PCI and HIPAA. Most of them are actually pretty scathing. Now, as far as going into the substance of the article, there was one that was a lot deeper than the others, and that's the Staley dissertation that was 647 pages. And it's about regulatory compliance, checking the box, and securing information systems. It was a pretty good dissertation, but it covered a lot of things and didn't go into a lot of depth about HIPAA and PCI as I had hoped. but it did cover some key concepts. Staley noted that HIPAA has a broader application than any other law or regulatory requirement. Interestingly, only about 7.7% of the respondents of the study who had implemented HIPAA in their environment were actually in the healthcare industry, but a total of 57% had to be HIPAA compliant, but were outside of specifically providing healthcare services. So that means that they were like covered, that they worked for covered entities. They were probably business associates of covered entities that were subject to pass the requirements. The study notes that HIPAA requires entities to protect the confidentiality, integrity, and availability of PHI studied on electronic mediums. And to do this, the Health and Human Services has the ability to fine covered entities for the HIPAA, for breach of the HIPAA privacy rule for $100 to $50,000 for each instance of a violation, and that stacks up to 1.5 million per year. So there's a pretty notable motivation. It's a pretty significant fine that can be assessed related to it. So it's a significant driver. And with regard to protecting the availability of information, HIPAA extends further than other regulatory requirements, such as PCI-DSS, with its more concerned with protecting confidentiality of cardholder data, per Staley's understanding. And Staley also performed a comparative analysis of PCI, DSS, and HIPAA security requirements. He identified that the two regulations have 127 requirements in common. PCI-DSS has 119 unique requirements, and HIPAA had 46 unique requirements per his observations. The security requirements were ranked from 1 to 10 to reflect the requirements from a high, from a low to high value for security value. The scores were also given a weighted value of 0.1 to 1 and just ranked overall to evaluate the depth of the requirements, particularly in comparison to the two regulations. With regard to the actual security of PCI and HIPAA, both regulatory requirements ranked relatively low once he completed all his full assessments. He and his respondents scored HIPAA at 27% impact and PCI-DSS at 54% impact. And the combined framework was ranked at 61% overall if you merge the two together and treated them kind of like one standard. As such, Staley concluded that the individual or combined frameworks could require additional security controls to protect against security breaches. As such, entities can be considered compliant with either or both, but still not be considered secure across the board, which is not unexpected. That's pretty common. He just established better than the other ones did. And note that the two rankings are in relation to the overall strength of the respective requirements rather than the actual impact on controls across security layers, due to the focus of the individual regulatory requirements being either overly specific or related to a specific control attribute types, or the propensity to be overly broad on non-specific and really just not direct enough to be measurable. They can't be assessed at each control layer. For Article 2, the paper A Tale of Two Standards, which is HIPAA or PCI, the devil's in the details. Schindel performed an exploratory evaluation of HIPAA and PCI-DSS. He discusses the applicability, implementation, strengths, and weaknesses of the two regulatory requirements and the common misconceptions across them. However, the analysis is explanatory at best, and it just doesn't go into significant detail or delve into the actual efficacy of either standard or the influence and the respective control layer. It's kind of just his opinion that it's just not effective. Article 3 in this paper, it's another one called The Tale of Two Standards, but strengthening HIPAA security regulations using PCI-DSS. Gaynor contrasts the differences and strengths between HIPAA and PCI-DSS. And Gaynor discusses the healthcare providers must increasingly comply with both HIPAA and PCI-DSS. Basically, they're using PCI-DSS to strengthen HIPAA as they do credit card payments as well. And with Gaynor, when compared with similar security standards in other industries, such as payment card industry DSS, HIPAA only vaguely specifies the need to protect healthcare information. It doesn't specify how such information should be protected. So Yeaner noted that there's also 6 goals and 12 requirements within PCI-DSS and their respective strengths and weaknesses, as well as the HIPAA privacy security layer, safeguards, standards, and requirements and their respective strengths and weaknesses. The paper combines PCI-DSS and HIPAA requirements using a matrix to identify and correlate the coverage and gaps and the administrative standards and physical standards and technical standards and documenting standards at these different layers, but once again at a really high summary level, not at a control layer level. It's more of a descriptive level. And ultimately, they conclude that PCI-DSS provides more actionable requirements than HIPAA, which is, once again, no surprise. Article 4 in this paper, HIPAA and PCI are failures. Campbell excoriates PCI-DSS and HIPAA for both being ineffective. His contention with PCI-DSS is that it's self-policing run amok, is his exact quote. The lack of government-mandated action and voluntary compliance leads to an ineffective and toothless program that results in the loss of tens of millions of credit card numbers. Most companies that fail to protect card numbers must pay a fine, and the penalties are inadequate justice for the resulting problems and impact on customers. Campbell contrasts what he calls the toothless PCI-DSS with the very toothy HIPAA regulatory requirements and stiff fines that can total up to $1.5 million and even 10 years in prison for those who violate HIPAA privacy rule standards. However, he identifies that the federal government's HHS site, healthcare.gov, does not even employ their own HIPAA security controls, and that no one's been prosecuted for it. So he kind of laughs about that. Therefore, Campbell considers HIPAA as a failure as well at enforcing the agency's own rules, and that the government contractors responsible for the mishap have not been charged. And moving possibly into my favorite one of these articles, mainly because I like the visualization, is this 2010 paper, and it's a general comparison of FISMA, HIPAA, ISO 27000, and PCI-DSS standards, and overall a nice little look at NIST. And in it, GECAS describes each of the regulations or standards and provides a cross-sectional matrix of specific technical requirements contained in each to enumerate kind of a yes-no if they are required in each of the other 4. The study does not evaluate the efficacy of the individual security controls, providing a meaningful assessment of the impact of each layer, but it does provide a good assessment kind of across the board for the overall coverage between the various different regulatory requirements and standards. And even with this very generous interpretation of applicability and efficacy, it concludes that HIPAA and PCI DSS contain very little overlap and much less actual security impact than ISO 27000 or FISMA/NIST. It also identifies that HIPAA and PCI-DSS have little to no overlap, once again, with each other, as represented in Figure 4. There are several common points of agreement between the literature sources on PCI and HIPAA, and these include: 1, HIPAA and PCI are independent, and compliance with one will not necessarily ensure compliance with the other, and each requires its own independent assessments. The 2 regulatory requirements apply to each different data sets, which have their individual data security requirements. And 3, specific technologies are not mandated, but data protection requirements are. 4, the regulatory requirements are more different from each other than they are alike. 5, PCI may suffer as compliance is semi-voluntary, as it is enforced by private entities, card brands, that can only place restrictions on receiving credit card payments, while HIPAA is government regulated and has legal teeth and can enforce a greater degree of compliance and impose jail fines. People go to jail for HIPAA, but not for PCI. But that doesn't happen very often. However, while some of the literature views the private enforcement of PCI-DSS as negative, it also recognizes that PCI-DSS is stronger of the 2, and ultimately it creates a stronger and more quickly adaptable set of requirements. It's really been determined to be a lot more effective, even though it doesn't have that same type of teeth that government boots on the neck would enforce. Moreover, even though PCI-DSS violations can result only in civil penalties, it does create a strong motivation for compliance because there's millions or even billions of dollars that are on the line. In summary, the literature focuses on defining or exploring the substance of the PCI DSS and HIPAA regulatory requirements and their respective strengths and weaknesses in comparison to one another, other regulatory requirements or standards, or as viewed by respondents in the surveys. In all of the studies, PCI was determined to be stronger, more quickly evolving, and up to date of a framework than HIPAA. However, most of the studies determined it to be handicapped by the private enforcement mechanism and ultimately lacking due to voluntary compliance. However, all of the literature identifies PCI DSS and HIPAA as being significantly lacking in driving strong security programs in affected environments. Moreover, none of the available literature and accompanying studies addressed the research questions or review the actual impact of PCI DSS or HIPAA on improving the applied security controls by the respective control layers within the affected environments. As such, the focus of my intended dissertation subject would be a good angle to pursue, and this is a novel area that needs to be better understood to kind of help the community and to try to build a stronger framework to create better security across the board.